Good morning, everybody. Welcome to today's webinar. Before we begin, I would like to acknowledge the traditional owners of the land in which we're meeting. I'm meeting on Wurundjeri land of the Kulin Nation, and I would like to pay my respects to elders past and present, including any Aboriginal people who may be on the webinar today. Thank you for participating in this webinar. We acknowledge that the COVID-19 situation has been incredibly difficult for many people, particularly for children and young people with disability and their families. And we know you've been hit hard by this situation. Not only do you have concerns about the actual infection itself, which has meant many families and young people with disability and their families have been self-isolating because of that fear, but we know that daily life has become much harder, and so therefore we're delighted to be joining with the NDIA for this webinar to really go through some of the questions that people have had and aiming to provide you with the latest and up-to-date information. We know for many of you the move to remote learning has been very hard, and that while schools haven't been in a physical space, that has put additional pressure. So we'll touch on some of that in our questions today as well. So thank you everyone for joining us. We want to also, before we begin, acknowledge the really hard work, and I've just realised I forgot to introduce myself. I'm Mary Sayers, I'm the CEO of Children and Young People with Disability Australia. And we acknowledge the work that the NDIA has done to adapt and be flexible in these times, and very unprecedented times, and the speed with which the NDIA has made decision has been very appreciated. So we look forward to hearing from Scott McNaughton. But before we do, I want to just go through a bit of housekeeping. So if you could check your audio settings at the bottom of the your screen to make sure the speakers are working well. Hopefully you can hear us. The webinar, as you will see, we have Auslan interpreting as well, which you should be able to see on the screen along with the speaker. The session will also have live captions, and they'll be visible at the bottom of your screen. But if for some reason you can't see them, click the CC button at the bottom of your screen to access the captions. The session today is also being technology issues. Please stay logged in because we'll be back up and running as soon as possible. Hopefully that won't happen. So in relation to what we'll be covering today, thank you when you registered for sharing your questions with us. We have compiled a list of the top 10 questions, and there was some commonality in the questions. We hopefully will get to all of the 10 questions in the webinar today. But as we're going through, you may also have more questions. And you'll see at the bottom of your screen, there's a Q&A function. And so the Q&A function will be monitored throughout this webinar, and it allows you to ask some questions throughout the webinar, some of which we might be able to answer just by posting back to you. And some of them we'll be able to ask Scott when we've finished the 10 questions as well. But if there's any questions that we can't get to, then we'll actually endeavour to get back to you afterwards. What we won't be able to do today is go into individual or specific circumstance-based questions. And we ask, if you do have any of those questions, that in the Q&A you put your contact details, and then we'll hand them on to the NDIA so that you can actually get a response to your individual circumstances. So please be patient. We hope we get to all your questions, but of course, we only do have an hour. So now it's my great pleasure to introduce from the National Disability Insurance Agency, the General Manager of National Delivery, Scott McNaughton. And Scott has worked at the NDIA for 6 years and has a long and distinguished career in the public service, including working at the Department of Social Services, the Department of Human Services, and now the National Disability Insurance Agency. I also had the pleasure of working with Scott many years ago, but we won't say how many years ago today. So what's going to happen is Scott's going to do a brief introduction to how the NDIA has been responding to the COVID-19 situation before we open up the Q&A and go through the top 10 questions you've provided us. So thank you very much, Scott.
Yeah, thanks, Mary, and thanks again. Lovely to see you again. Yes, we're a bit younger and less grey back in the day when we worked together. Well, I was anyway, Mary. So lovely for you to be inviting us, and we really welcome the work that CYDA is doing in such an important time for all of us. I'd just like to pass on apologies from Martin Hoffman, our CEO, who's unable to be here today, but I know he was part of the CYDA session earlier this week. He said that was a really good session and asked me to come on today. So I'm really pleased to be here. It really is a challenging time for people, isn't it? You know, this COVID pandemic is changing the way we go about our daily business. About our usual routines have changed. We're spending a lot more time at home. We're spending less time in our community physically, and it's meant to. It's led to a whole range of changes that we've all had to make, and it's very disruptive and challenging. And our real collective aim here at the NDIA is to make sure that we continue to provide as much access as possible to quality disability services. Because as much as we can maintain the delivery of those services now, it'll be really important that once the restrictions are lifted, that people can get on with their accessing their services, potentially how they used to access them before COVID was upon us. And I just really want to iterate that one of our key objectives here is to make sure that the health and safety of our participants, of carers, of families, and of course our staff and our providers is paramount. It's really, really important that we're protecting the safety of everyone, which has meant we've had to make some changes to the way that we implement the scheme and support our participants. But we have made some really important changes to help respond to COVID. And really this has been focused on providing as much flexibility as we can for families to address their child's disability related needs. We've also been extending people's plans, and we know that this is a really good safeguard for participants who may not have been able to have a plan review for whatever reason. We're automatically extending people's plans for up to 12 months. And what this does, it just creates that certainty and lets people continue to get those key supports that they've been accessing. In addition to that, we are trying to create as much flexibility as possible so people can access their disability supports. We're also created a dedicated phone line with our National Contact Centre. So if people have queries or concerns around COVID-19, they can call our contact centre. I think it's you press number 5 and you go to the dedicated team there who can explain to you about using your plan flexibly or even connect you into our specialist planning team if you need to make an urgent change to your plan because of anything to do with COVID. In addition, we're making calls to around 62,000 participants who are our more vulnerable participants to essentially check in on them and see how they're going, make sure they got the right information, the right supports, and they're connecting to services as best they can. Of course, we've shifted most of our planning meetings now to phone-based, and that's really in response to the physical distancing rules. And the feedback from that's been quite good. And we're having conversations with people around their plan reviews and the ability for people to actually extend their plans for up to 24 months now to create even more longer term certainty for people so they can get on and implement their plans and connect to their services. So a number of changes we've been making to respond to COVID. We do know though, and we're hearing a lot of this, that one of the things that has been a response to COVID is the way that we're changing the nature of delivering services and the way the providers are delivering services. and a lot more use of telehealth and telepractice and teletherapies to ensure that participants can continue to get their key supports, even if it's not in that face-to-face delivery model. And we're seeing some really innovative approaches emerge because of that, which we think is great. Now, some things can't be delivered by that way, we know that, but there is a lot that is, which is fantastic. And we're seeing video conferencing, we're hearing about smart devices and smart TVs being used for therapies, Zoom calls like this to connect with people. So we think that's really important. And that's one of the reasons the Minister recently announced, our Minister, Minister Robert, announced a better supported use of flexible funding to help with the purchase of low-cost assistive technology up to $1,500. And this really helps participants maintain their disability supports. And this new approach is really in response to those face-to-face services now being delivered online, and helps those supports continue to be accessed by participants who may not have those devices already. So this is a time-limited policy up until September this year. We'll review it to see how it's going in July, but we understand that's been well received so far. And I'd encourage people to talk to their service providers around that, or contact us if you'd like more information, but that might well come up in some of the questions later. We also know that supporting school-aged children is a real, it's been a real change and a real challenge. And can I just say personally, I've got two daughters, one's doing VCE remotely, and we're having our ups and downs, that's for sure, at home, and I know how challenging this is for families, and my wife actually is an integration aide, and so hearing how she's had to adjust, how she supports her students, no doubt it is a challenge for people, but we are also hearing some good things around how education systems are responding. And so it has been a change, and what we do know is education is the responsibility of state and territory governments. We know that, but the NDIA does have a role to play. And in particular, that is working with participants, working with families to ensure they have the disability-related supports they need and that they're in place during this time. And so children and young people with disability, they can continue to learn and continue to access their key supports during this period. Because we, like all governments, are committed to the ongoing education of all students, including students with disability, throughout this period. We're starting to see in the media some different approaches across the country with schools returning or staggered returning, and we think that will continue to happen. Those decisions are, of course, decisions for state governments, so that's not for the NDIA to comment on that, of course, but we'll see a progressive return to some sort of schooling, we suspect, over the coming weeks and months. And we really encourage parents and guardians of participants, to continue to use their plans flexibly, to continue to talk to their schools, talk to their providers, and to make sure that we can provide those key supports that those children need, so they can continue to engage, whether that's in the education system or through their other therapies and capacity building supports at home. And so that's been really, really important message for us to continue, for parents, is to continue those conversations with providers, with their therapists, about how they can continue to support the delivery of those at home. Whilst the education system, of course, will continue to provide the various things that, such as accessibility, equipment, assistive technologies in the schools, which you'd expect under the normal circumstances. And the scheme will continue to fund what we can fund, those therapists and personal care and other supports at home that are required. And again, if you're, my message to everyone out there listening, use your plan flexibly. If you're not sure how to do that, contact us or contact your local area coordinator. We can give you much more information about how that will work. And speak to your providers, because providers are doing some really good things around supporting people during this time. And please contact us on our hotline, on our dedicated number through our call centre if you've got any specific questions. I just want to close before we move on to questions, Mary, just to say that really a real key area of focus for us is to make sure that our participants, NDIS participants, continue to get their disability supports they need during this time. But we do know it is a changing environment for everyone. Use your plan as flexibly as you can. Contact us or your local area coordinator or your early childhood coordinator to get as much support as you can. We have set up a specialist team of planners within the agency who can assist with any information, make any plan adjustments that might be needed because the plan needs a bit of an adjustment to help during this time. And we're putting out regular, frequently asked questions and information on our website. So really encourage people to check those out and get as much information through there as well. You know, we're continuing to try to respond to questions that come up. And we put them on our website. So I might pause there, Mary. I know there'll be lots of questions, so I want to allow plenty of time for that. And once again, thanks for inviting me to this session.
Terrific, and thanks for that overview there, Scott. Look, we've had some people that have come on through the course of the introduction, and I just wanted to go back to some of the instructions. You'll see down the bottom of your screen there's a Q&A. Please feel free to send in your questions as we're talking, as you're thinking of things. And also we do have closed captioning. So at the bottom of the screen you can turn on your closed caption. So I've seen some of the questions coming in, but please keep them coming. So Scott, just to go to our first question, and this is really a question that has come up, and we have a number of people on the line who actually are not yet NDIS participants. And the question that came up was, how can I get NDIS funding with the current pandemic restricting assessments?
Yeah, thanks, Mary. This is a really good question. Can I just assure people there's no changes to how people can access the NDIS during this time? And in actual fact, what we've done recently is we've made available on our website what we call our access request form and our supporting evidence form, so people can download that and then they can talk to their, whether it's their GPs or their specialists or their occupational therapists, whoever it is, they're going to get that help with filling in those forms or supporting evidence. And they can submit those forms electronically to us now. So that's been a big change. In fact, I think we've had over 3,000 downloads in the first couple of weeks of that form going online. So that's proving really popular. But of course, people can still go through all those usual channels of getting information about accessing the scheme. So if you've got a child who's under the age of 6, you can go to any of our early childhood partners. You can go to any of our local area coordinator partners, and their details are all on our website. Or of course, you can call our 1-800 number. It's 1-800-800-110. And you can actually start a verbal access process just by contacting us. So really important if you would like more information about access or eligibility to the scheme, or you'd like to test your eligibility to the scheme, you can download the form, you can contact our providers, early childhood or LACs, or contact our 1-800 number, and we can give you that information and start the access process.
Sorry, Scott, I guess the message then is, if you, and we know that there has been some challenges with people accessing telehealth and the things like that, but I guess the message you're giving us, Scott, is if you're stuck, give the agency a call and the agency will be able to talk you through the process. Is that correct?
Yes, that's correct. Absolutely.
Yeah, fantastic. The next question, Scott, and you touched on the assistive technology arrangements that were announced, and given that you've spoken a little bit about it, we had some sort of more nuanced questions about that. In terms of, you know, are there any restrictions on equipment that can be purchased? You know, what might differ for self-managed participants? So perhaps if you could give us a little bit of information about that in terms of the assistive technology.
Yeah, thanks, Mary. There's certainly been a lot of questions around this. Look, we are hearing, as I mentioned earlier, a lot of really good examples from providers about how, and participants also, feedback from participants about how they've continued to be able to access their supports that were face-to-face previously, to be able to access those online. because we don't want people to stop accessing their supports during the pandemic. We want people to keep those therapies and keep those other capacity building supports or whatever those supports are going. Where they can be done online, we're hearing some good things around that. So what Minister Robert announced on the 27th of April was that participants can now use their existing funding to purchase low-cost assistive technology, such as smart devices, where those devices will help them continue to access and receive their NDIS supports. So participants can spend up to $1,500 out of their existing plan on AT supports. However, most people shouldn't need to spend more than $750 on one device. And so that's some feedback we've had from AT specialists and others that usually a standard tablet type device is around $600. So that's why there's an upper limit of $750 per device, but with an overall of $1,500. So people can use their existing budget and they can access that flexibly. They should really talk to their providers, because the providers will say, yes, you need this. This is how we're going to deliver your supports. And the providers will give us, a letter or verify that this is going to confirm in writing that they need this device for their ongoing therapy and supports. And then participants can access that funding through their plan. And we're actually making some changes just this coming weekend to make the core budgets more flexible, so people can access that money if they need to. So for plan managed and self-managed participants, they can access these fundings from any providers, because self-managed participants don't need to access registered providers, as people know. And if you're agency managed, you can purchase these from any registered NDIS provider, including your therapy provider, support coordinators, and there are some other providers out there, in fact, sort of more retail type providers and other providers of AT that you can purchase these from. So you can get on our provider finder and find those out. We do, Mary, get quite a few questions around internet and data. Can you use your plan for that? It does continue to be the scheme and agency's policy that daily living expenses like grocery, like rent, like food and regular bills, including internet charges, are personal expenses. And as such, the plan's not able to be used for data and those type of items. But so the $1,500 is for the AT item itself.
Terrific. Thank you. Thank you very much, Scott. And this is kind of a related question, and it's around what you were talking about with service providers actually changing the mode of the way they deliver services. And we've had feedback from participants and their families that they're finding online therapy is not working for their child or young person, and they need more sessions than if they were doing face-to-face therapy. So the question really is, is the NDIS aware that the support budget may need to increase if the therapy is delivered online and not the same outcomes as a face-to-face? So perhaps if more sessions are required and things like that. So perhaps if you could talk us through what people should do if they're in that circumstance.
Yeah, thanks, Mary. And as I mentioned before, we do know that a lot of those supports that people used to access, their support worker would come to their house, or they'd go to their support workers, or other sorts of, whether it's group therapies or other sessions, are not happening to the same extent. And whilst there have been some really innovative approaches to online delivery, as you said, some people, it's not quite the same. But for some, we're still hearing some really positive things. So look, the key message here is to talk to your provider around this. Some of the feedback we've had is people, rather than having an hour or 2 hour session, people now like to have 30 minutes or 45-minute sessions. So people are saying, I want to have more regular but shorter sessions. Or we might have shorter sessions online, and then once we can go back to face-to-face, we can then move back to having longer sessions. So this is the flexibility we want people to have with their plans and with their providers, to make sure they're managing it to how it best suits their needs, their child needs, the participants' needs. So really important there, and that makes sense too. if rather than a 2-hour online therapy session, which isn't actually bearing the results of an hour face-to-face, you might want to reduce that for a period of time and then be able to use that funding later on. So again, talk to your therapist, talk to your provider around that. Of course, if someone's disability support needs change and they've run out of money in their plan, they should contact us. They should contact their local area coordinator or their early childhood partner, and we can talk them through around what their options are and make any necessary adjustments to the plan that may be required. So, you know, it's a bit of an individual response. So what's working for you, what's working for your child, what's working with your provider, you have the flexibility. The funding is yours. It's not the providers, and you start talking to them more and more around how you want to engage in those supports and how you might want to do more, less, and work that out over the course of the period of time. So, you know, hopefully in the next few months, Mary, we're getting some of the restrictions lifting and people can go back to more face-to-face delivery. You know, we just got to obviously respect all of those physical distancing rules for now.
Yeah, fantastic. And it was great what you said about the, you know, the length of time, because all of us who have been participating in these sort of online environments know sometimes the time is a little different being online to actually face-to-face. So thanks for picking up on that, Scott. The next question again is about flexibility. So can families transfer funding from one funding line to another? So core supports to capacity building or to and from consumables, and if they can do that, how do they do that?
Yeah, we obviously want to create as much flexibility as we can. So this is a really important question, and it's one of our common questions we get through our contact centre and others. The simple message is your core budget is the most flexible. And in most cases, you can use your funding across all support categories within your core, with the exception of if some participants have what we call a periodic transport payment. So that's, you can't use that flexibly, that's an ongoing periodic payment. What we're doing within the core budget this weekend is, if people don't have funding in each of their buckets within their core budget, we're putting $1 in each of those, which will then allow people to access all of their core budget more flexibly, besides the transport budget I just mentioned. So that's a system change happening this weekend, and we'll put some messages out around that. But that's going to be a really important change, because that'll create even more flexibility within core. At the moment, though, you can't just pick up any capacity building money and move it across to core without us having a conversation with you as a plan review conversation. So this is where we'd encourage you to contact us or your LAC partner. So if someone does say, I've run out of core, but I just want to use some of my capacity building for this support, can we move some of that money around? Contact us, contact our 1-800 number, press 5, talk to our team there, and they can talk you through your flexibility options. And if need be, we can have a look at your plan, potentially review the plan and see if we can move some of that money around to create more flexibility during this time.
Thanks very much, Scott. And the next sort of questions, and I can see we're getting some great questions coming through the Q&A section, and hopefully we'll be able to get to those as well, because there's some really terrific questions there, and keep them coming. This one's particularly, given this webinar is about school-aged children, there's been a lot of questions about using supports flexibly in the remote learning environment. So, you know, one of the questions is, can we access funding to increase support worker hours given our child is not able to access their usual learning and education? You know, how can families access core supports for school-aged children if they didn't have those types of core supports in their plan already? You know, how they can use their NDIS funding to assist with the learning from home process. So that's kind of a grab bag of a few questions in one. So we can, I'm not sure how you want to handle that one, Scott, but I'll hand over to you.
Thanks, Mary. I'll give it a go. Look, I think it's important just to reiterate that the NDIS doesn't replace other support systems. We know that, such as childcare or school education systems. And certainly the education system continues to have the primary responsibility of providing inclusive education supports for all students, including the training of teachers and aides and making education accessible. But whilst it's not the role of the NDA to provide education, what we can do, and certainly what we are doing, is working with participants, working with families and carers to provide them with as much flexibility during this time so they can continue to get that disability support in the home. So I'll give you an example of what we're seeing and hearing a bit of. So whilst it's not the role of a support worker to provide education to an NDIS participant or a child who's at home, if the child's funding has, the child's NDIS plan has funding for a support worker to provide in-home support or therapies, the families can use that funding flexibly and use those hours flexibly to support the child at home. And they can help with any of those disability-related tasks. The support worker can be in the home and help to do that. So this is really important. It's really important that parents talk to the support workers, talk to therapists about how they can use the plans flexibly to deliver those in-home supports so the child can continue to get their disability support needs delivered in the home. And we're hearing some more and more examples of that working quite well. And again, this is good conversations. And if you're not sure about where to get information about support workers, get online to our website. You can find the providers there. We list all the providers in each of the state and territories. There's links to a whole range of provider markets where people can connect with various support workers. And we'd really encourage participants to do that. And as I mentioned before, if you need assistance or if your funds are running low in those different parts of your plan, give us a call, call our 1-800 number, 1-800-800-110, speak to our special team of planners there, and they can give you some more advice around what some of those options are. But key message there, Mary, is talk to your support workers about using that flexibly to ensure we can continue those disability-related supports in the home.
Sorry, just unmuting. And the question about if they don't have support workers already in their plan, is the best bet for them to do a light touch review or talk to their LAC, talk to the agency? What would you advise if their current plan, because normally kids would be at school at this time, isn't including what they need? Is it to come back? Is that your advice?
Yeah, absolutely. Come back and talk to us about those things, because what you might have in your plan is funding for therapy or other capacity building supports, which can be used to deliver those sorts of supports in the home as well. So we can talk through the various options that are available, or as your other question was earlier, do we need to sort of move potentially some of the funding around within the plan to access some capacity building in the core budget? So that's another option there that we can talk through.
Terrific. And I noticed, the quality just dropped out a little bit there for a while. So hopefully we're broadcasting loud and clear to you all there, and stay with us. We'll very soon. This one is around the transition back to education, but I might actually hold that off, Scott, because we've got a few related questions about education that we might come back to in the open Q&A section. The next one comes to social and emotional supports, and we have heard a lot that this is a really difficult time for children and young people with disability, the loss of some of the routines and structures that they've had in the past. So how do you think the NDIS can support participants to maintain some of those support networks that for children and young people with disability in this environment?
Yeah, this is another really good question. Thanks, Mary. It has been a big change, hasn't it? This whole social distancing, and what I like is the shifting of that language to more physical distancing rather than social distancing. And that's a powerful change in the language, because we don't want people to stay socially disconnected, even if you're physically distancing. We want people to use all of those technologies, that we've been talking about through Zooms and chats and phone calls and all the regular online ways that people can stay connected. We really encourage that. So please really encourage people to do that. Stay connected with family, stay connected with friends, do all those things within your community, because we will start hopefully over the coming weeks and months to be able to get back out and connect more physically with people. I've been watching the media this morning about will we be able to go and visit our mothers on Mother's Day. My mother's 80 and I desperately would like to go and spend Mother's Day with her, so hopefully there'll be some relaxation of some of those rules. But these sorts of things are really important. But we've also heard, again, this goes back to some of the work providers are doing. And providers, we've heard of online dance classes, online therapies, online group social activities, and seeing some really good examples of that emerging, which keeps people connected. So again, have a look out there. If your providers are not doing that or not providing that, hunt around, because we are hearing some really good and innovative ways that people are staying connected. And when we're making our proactive calls to participants, this is one of the things that we're checking in on them and checking in to make sure that they are connected. People are at risk, aren't they? We know that the evidence is there that people's mental health and other sorts of, disconnection can lead to depression and isolation. We really want to make sure people are staying connected. And if we need to refer people on to the right external agencies, whether it's Beyond Blue and Lifeline and others, we're certainly doing that too, because we want to make sure people if they are feeling they're starting to feel a bit anxious or starting to get a bit depressed because of the disconnect, we want to make sure that they can reach out to some professional agencies who can help them during this period. So really important that that message is out there. Talk to your providers about what you can do, stay connected through all the various online ways. And if you or someone who is feeling really doing it quite tough, make sure that they're getting the right connections to those right professional organisations.
And look, and the next question is a bit of a related question, which is going to become more important for participants as the relaxing commences. And given that, many children and young people can be immunosuppressed, and there's a fear of, infection, which is, we've seen how quickly it spreads. How can participants access PPE? I'll go away from the acronym, personal protective equipment, and it's commonly known as PPE, which is masks, gloves, things like that. So have you got any advice there, Scott?
Yeah, thank you. Like all of us, we need to follow the advice of the Department of Health about when PPE or personal protective equipment is required. There were some shortages, weren't there, early? We saw all that in the media, but there is a much better stockpile of PPE in the country now, which is great. So participants can talk to their providers about access to PPE. We've made PPE accessible to NDIS providers. So if they're coming into your house to deliver personal supports, our service providers have access to a national stockpile, and the government has essentially quarantine a supply of those PPE for NDS providers, which is great, a great initiative. So that's really important. So if you are feeling the support workers coming to my house, I think they should have access to PPE, you can actually refer them to the national stockpile, and they can get access to that. For participants, they too can contact the national stockpile if you think you are requiring some of that. I would get, so that there's a Department of Health website. They've recently announced there are additional 500,000 masks available to the disability sector, which is great. It includes primary health networks and the NDIA. So access those as you need to, especially in those circumstances that you mentioned, Mary. And it's pleasing to see that there is more of this equipment in the country now in response to that. So get onto the Department of Health websites around the National Stockpile, and you can get information about how to contact them.
And that's the same for people who might be self-managing, Scott. So can self-managers access that national stockpile?
Yeah, so contact them. Obviously, the priority has been to allocate that out to all service providers first, and then they'll, if there's additional, they're making that available for hopefully for participants and self-managed participants there. So with the increase of stockpile, we're seeing more availability of that, which is great.
Terrific. Going well with these questions, so we're firing them at you. Look, the next two, or probably 3 questions are kind of about the funding and review process. So I guess, is there anything that you haven't said already about how reviews will change because of COVID-19?
Yeah, I'll just reiterate a bit of work we're doing around reviews, and just firstly to reassure people that your plans will not expire. If for whatever reason you have not been able to have a scheduled review of your plan, we're automatically extending your plans for 12 months. This will continue to get your ongoing funding, and you can continue to receive those key supports. But we are, obviously, one of the big changes, we're doing scheduled reviews now over the telephone in response to social or physical distancing. So we'll be contacting you and having the review conversation over the telephone. We'll be offering, if your circumstances are fairly stable and the plan's working well, for you to have a much longer plan, up to 2 years or even longer, but usually up to 24 months. And then again, that just gives a longer period of certainty. And we're hearing a lot of great feedback from participants saying, I've got a pretty good plan, I've got the right supports in place, I don't need to come in for an annual review anymore, I'm happy with a longer period of time, I've got good connections, let me get on with it, basically. So that's another option. So really, just to reassure people, your plans won't expire. They will all be extended for 12 months if you don't have a review before then. So if your review is coming up, we normally contact you between sort of 2 to 3 months before you review your plan and start a conversation around that. So we're still continuing to do that via the phone.
And what about, Scott, if because of the changed circumstances, because of the COVID-19, your current plan, you're not near the end of it, you might be in the middle of it, and it's just not fit for purpose anymore, what would you recommend then?
Yeah, so if there are, because of the COVID pandemic and because of any critical changes of circumstances that you have, you can contact us or your local area coordinator or your early childhood partner and ask for a review of your plan. And they'll first talk to you around, have you got existing funding to use flexibly? But then, of course, if there has been change of circumstances, we can do a review of your plan and make sure you've got the right funding for your disability supports you need.
Fantastic, thank you. Again, the message I'm hearing is get in touch. If things aren't working, get in touch and talk to your LAC, talk to your early childhood intervention partner, give the hotline a call. Reach out if you're struggling. So thank you, Scott. The next question relates to some of the changes that have come around because of COVID. One of them is if people can't use all their plans because, if they can't use the funds that they've got in their plan, will they be disadvantaged if they can't utilise a large proportion of the funds because of COVID-19?
Yeah, look, this is a really good question again, and we've talked a bit about how service delivery has changed because of COVID. So some of the ways in which you traditionally got your supports has changed, and if you can't access all of those online now, it may mean that you haven't been able to use all of your funding. I can assure people they won't be disadvantaged because of that. As I said, hopefully over the next weeks and months, we'll be able to get back out and access those supports, how we used to access those supports. And when you come to your review, of course, we will take all that into consideration. And as we review the plan, it's really about what are your goals and aspirations, what are the disability support needs you need for the next 12 months or 2 years, regardless of what you spent in your last plan. So You won't be disadvantaged because of that. We're very conscious of what's gone on over the past few months. You don't need to be anxious about that at all. We'll look at what are your requirements for their upcoming plan and what we need to fund accordingly.
Fantastic, thank you, Scott. And we are having a little bit of lagging with the technology. I think the whole of Australia might be on a Zoom meeting at the moment. So stay with us and be patient. The last question before we go to our Q&A, Scott, is around decision that was made to support service providers. We know that everyone in the economy has been affected by the COVID-19 situation, and that decision was to enable service providers to charge a 10% price increase, but the plans weren't increased. So again, it comes to that question around concern about, plans might run out more quickly. What can participants do around that?
Yeah, thanks, Mary. So just to reassure people around this one as well, we want to make sure you've always got the right amount of disability-related supports in your plan. This change was put in place to really shore up the provider network so they can continue to deliver those key services for participants. So providers, it's a temporary loading and a temporary change to the cancellation fee. We'll be reviewing that shortly. If a participant runs out of funding because of that, then that's something that we will review as part of their plan. They can contact us if they are concerned that their funds are running low, and we can discuss their options and look to review the plan and put the right disability support funds within their plan. Most people across the country don't always spend all of their plan each year. So we call it utilisation rate. Most people don't utilise 100% of their plan. So we think, given it's a temporary change for a small period of time, that we should be able to absorb it within the existing plan. But if personally that's not your situation, then again, Mary, really encourage people to contact us or the local area coordinator, and we can talk through the options there, but you won't be disadvantaged for that.
Thanks very much, Scott. Really appreciate it. So we've got quite a lot of questions. I'm not sure if we're going to get through to them, but I might, before we get to, because there's some specific education related questions, there was just a couple of process questions, and it comes back to our access question at the very first question, is people are finding it difficult to get supportive documentation when specialists and therapists will not conduct assessments for a report. So what do you advise in that situation? And happy if you need to take that one on notice as well.
Yeah, we can provide some more information, Mary, about this one, but this is an issue that it's probably not actually specifically related to COVID. It's about how potential participants, I should say, need to access the right evidence to support their access to the scheme. So the beauty of the ability to download the access request online is GPs and specialists and others can also have access to that electronically. So some of them are willing to, do the assessments over the Zooms and other things like that. So try and connect in with your specialist, your therapist, who can complete their section of the access request and the supporting evidence form via online, if that works for them, to be able to get that. And again, supporting evidence, as it read through the form, can be your GP, can be a specialist, can be an allied health therapist, an OT, can be from a broad range of people. If your child is under the age of 6, I really encourage you to connect first with our early childhood partners, because they are trained as specialists, early childhood experts, and they will actually talk you through the process and what you may or may not need to support access. And our local area coordinator partners can also assist for children over the age of 7 as well.
Terrific, thanks, Scott. And then we had another question about the NDIA call centre, and if people have a COVID-related question, will they be able to be answered by the call centre?
Yes. So when you dial our 1-800 number, the messages will come up. We call them Ivr messages. It's number 5, and that goes off. So you press 5 after you've gone through, and that goes off to our COVID team, who are sort of the more specialist staff there who will help with all of your COVID-related queries about plan flexibility, access to PPE, all those sorts of things.
Fantastic. So people just need to ring the number and press 5. That's great. I might get to some of the school questions if that's okay, Scott, and some of them, you know, happy again if they're ones that you need to take on notice. One of them is around the teachers and the schools not providing reasonable adjustments for students with disability with the curriculum. Can the NDIA can the NDIS funding be used to engage the services of an inclusive education specialist to help in the home? And that might be one of those tricky ones that might need a bit more of a longer answer, or more thought from a policy position. So happy if you need to take that one on notice and we can get back to people.
Yeah, we might get some more information about this, Mary. At a very high level, it is really the education system's role is to continue to provide those reasonable adjustments and provide those supports to provide an inclusive education environment. That is the role of education. What is the role of the NDIA is to make sure that we can provide the required disability-related supports that child needs in the home. So if that is a disability support worker, a support worker assisting that child with their disability-related needs, as I mentioned, use your funding flexibility to do that. Otherwise, you should be talking to your school, talking to the teachers, the integration aides around what supports they can continue to deliver in the school system. But it is coming up a fair bit, Mary, so we might look at what other information we can provide around that. And also referrals through the various education systems where you can get more information around your needs for your child.
Yeah, and I think, Scott, a little bit more information will be really good, because a lot of these questions are coming up, and one's about the consistency of information. So one LAC had warned a participant not to use a support worker to assist with some of the home environment that might facilitate learning at home, and was warned they may need to pay back their NDIS funds. So I think what's coming through the line is some concerns about that blurriness that has shifted. So I think, I don't know if you want to respond to that one, or perhaps we can think about some more work on some guidance around on that.
Yeah, let's do that. I think clearly there's a bit of a need for some more information in that space. So we'll work on some information and get that out through yourself and through our website, etc.
Terrific. And yeah, again, concerns that people might need to pay back money if they do the wrong thing. So I'm getting the sense from the questions that are coming in, people are really wanting to do the right thing, but they are also knowing that this time is very complex, and the delineation is less clear than it's been when children go off to school during the day. Yeah,
good. And look, I think the message really, as long as you're using your plan for your child's disability-related needs, even if that's a therapist in the home or a support worker in the home because of their disability-related needs, that's what your funding is for. Okay, so if you stick to that as a high-level principle, you know, I think that's the right message. So, but we'll continue to get some clearer messages out for people on that.
Okay, I'm just going back through the questions, just making sure that, yeah, if I had to summarise, Scott, I'd say the majority of the questions are about the education interface that are coming through, and people want some really clear information about what's possible, what's not possible, and just some guidance. So that's terrific, and we'll look forward to working with you on some of that as well. In terms of other questions, we haven't had any other questions that have come through at the moment. If anyone wants to get on that Q&A, please do so. We'll give you a moment to add any more concluding questions. But I guess while we've got a captive audience, and we'll send you this when we send the link to the video, we do have an education survey open at the moment, where we're actually, CYDA is collecting information from young people with disabilities and from families about what their educational experience is at the moment, so that we can use that information to help all our stakeholders, including the NDIA, to understand what the current situation is. So whilst we may not be able to cover everything today, your feedback will be really gratefully received, and you'll get an email from us when we send you the link to the video following this, so that you can complete the survey and tell us what the experience is, and that way we can make sure that we can give back the information. So just a little bit of a plug there. Scott, is there any concluding remarks that you would like to make?
Oh, thanks, Mary. I think it's just reiterating some of the messages around, we get a lot of queries in our contact centre around, can I use my funding for this, or I don't have enough funding in my plan for these aspects. It's really important we continue to provide good information around using plans flexibly. Some people don't realise how much flexibility there are in their plans. And so that's an ongoing message and communication piece for the agency to create that. So I hope the listeners in there today have got a bit more of a sense about how they might be able to use their plans flexibly to continue to access their disability support needs. We don't want people to stop getting the supports during this time. We want them to get as much support as they can, and then hopefully over the coming months, as we transition out of the lockdown period, that we can start to get back to getting supports how we used to get them, or some combination part thereof. So. And again, just to reiterate, we've said it a few times, Mary, haven't we? If you are unsure, please don't stew on it at home. Give us a call. Talk to your LAC partner or your early childhood partner if your child's under 6, and we will we'll give you as much information as we can to help you out during this difficult and challenging time.
Terrific. Thank you very much, Scott. And, you know, it's been wonderful to partner with the agency. Great to hear the responses to the questions that we've put through to and also just to reiterate that, you know, Children and Young People with Disability Australia, if you've got any concerns, you can contact us as well, or if you've got any follow-up questions that you'd like us to follow up with the NDIA, we're more than happy to do that. And when you get the follow-up email after this webinar, we'll have our contact details as well, so you can contact us. But it sounds like, Scott, probably best bet, come back to the agency in the first instance, come back to your LAC, and then, you know, hopefully you'll get the answers you need. So thank you very much, Scott. Thank you to Celeste and Christine, who have been our Auslan interpreters. Thank you to Helen, who's been doing the captioning. And thank you to all of you for your interest in today's webinar, and we look forward to continuing to work with you. We will be putting this video online, hopefully either later today or first thing tomorrow, and we'll contact you so you can actually view the video plus the transcript online. So thanks everyone, and I hope you have a great day.